helping make your life easier. Moms Every Day.
Hi, welcome to Moms Every Day. I'm Hattie Cheek. Megan Shepard is with me. She was with the Department of Pediatrics at Marshall University, also with Cabell Huntington Hospital. And we're going to be talking about food allergies. It's definitely something that parents and kids all around, something that they need to be worried about or at least be knowledgeable of. So now, what exactly is a food allergy?
So food allergy happens when your body inappropriately recognizes a harmless protein in food as actually being harmful or dangerous. And this sets off a chain of events in the body that leads to different types of reactions depending on what type of food allergy you have. So the most common one that most people know about is an immediate type hypersensitivity reaction, and that's commonly associated with peanut ingestion or shellfish ingestion in those who are allergic.
Okay.
And that can consist of symptoms such as hives, itching in the mouth, itching in the ears. It can progress onto more severe reactions with swelling in the mouth, the tongue, shortness of breath, wheezing, loss of blood pressure, or loss of consciousness.
It can be incredibly scary.
It can be very scary, yes.
Now, is that the only kind of food allergy, or are there others?
There are others. There is something called oral allergy syndrome, and many people may have been suffering from this over the last few months, and it's when your body recognizes proteins in uncooked fruits and vegetables that cross-react with pollens that are in the air from trees and grasses and even weeds coming up in August.
So, and that's this time of year, so if you've been noticing something strange.
Yes.
So it's typically because of uncooked fruits and vegetables, you say?
Yes. The proteins in the skins of those fruits and vegetables typically cause itching in your mouth. You can get some itching of your tongue and some tingling, and it can be worse during those high pollen seasons. So if you don't notice it at different times of the year, that's why.
So if you had a kind of itchy throat, itchy roof of your mouth over the last couple months, you're like, what is going on? That may have been why. It's just kind of a seasonal allergy.
If you will. So, yes, some people it lasts year-round, but it's usually worse during the high pollen season.
Sounds awful. I mean, when should you see a doctor? When do you know that you actually have a food allergy? Because it can be misconstrued for other things.
Yes, no, that's exactly right. Food allergy diagnosis is very hard. So I would say if you have any concerns at all, you need to go to your doctor, because food allergy can be very dangerous depending on what type you have. So when you go to your doctor, they can either diagnose food allergy themselves based upon how much experience they have, or more likely they should send you to an allergist immunologist who's a specially trained physician in food allergy, and we can help you with the diagnosis.
Now, this may seem silly, but you know, we always ask this question: is there any way to prevent this?
Unfortunately, at this point, there is not a lot of information out there. We are thinking now that it is better to introduce foods early, and there's some recent evidence that suggests maternal diet may play a role. So eating peanuts is good, versus in the past women may have been advised to avoid eating those foods that are thought to be most allergenic, and now we actually think we may have inadvertently caused food allergies by advising to avoid all of those things.
Oh, bummer there. Okay, so we're going to try something different then. So if you are expecting, maybe you would influence them maybe to try a few peanuts here or there. Okay, so what kind of treatment though, if you do have these allergies? I know I was just saying to you before, my grandmother is allergic to shellfish. Is there anything that she could have done, anything that we can do to help this?
I would say, again, unfortunately, there is nothing that you can do other than, number one, appropriate diagnosis. Number two, early recognition of symptoms of the food allergy. And number three, strict avoidance. At some point in the future, we are hopeful that as a medical community, we're going to develop therapies that may help you tolerate some levels of those foods that you ingest. We're not there yet. Science is getting close. There have been some promising trials. But for now, the mainstay of therapy is avoidance and then early treatment.
Okay, and so are there any resources to help folks who need to manage this?
Yes, www.foodallergy.org is a really excellent resource. And additionally, I would encourage people to go online or go to their healthcare provider and ask how to use injectable epinephrine in case they're ever in a situation where they need to use it. And I would encourage people to also know that it seems scary, but you just have to be brave and you can do it. Whenever we use injectable epinephrine, the needle is no bigger than that for a flu shot.
And also referred to as an EpiPen, right?
Yes. Well, that's one of the brand names. There are several brand names
that's
out
the one
there
that
now.
I've always referred to.
I know, yeah, they do seem to have a hold on the market. There's also AubiQ and AdrenaClick, and so, and they are all used similarly, and you inject the epinephrine right into your leg. A person can do it themselves, or they can do it for someone who needs assistance.
All right.
So it's very important to know how to do that.
Very important to know how to do that. Thank you so much for joining us today. Good info. Just head to our website, WSAZ.com. Click on the Moms Everyday tab for more information. And also make sure you download our app, Moms Everyday. Thanks for joining us. We'll see you again tomorrow. Take care.